I'm terrified because in 2 years, I have to take an oath. I have to take an oath that says that I'm going to do no harm and I'm going to provide the best health care out there for my patient. I'm terrified because I know that's impossible. How is that possible when the majority of my patients cannot even afford health care?
It's not just that other countries spend less, it's that they do better. We trail the world in life expectancy here. Our infant mortality rate disgracefully high. We had this week the report that infant mortality is rising throughout much of the South. Our maternal mortality rate extraordinarily high by international standards. We also do huge amounts of unnecessary and even harmful work that we bill the public for. We've recently learned that probably 85% of the coronary stents that we put in this country do no good for our patients. So we have a healthcare system also wasting substantial resources that we could provide care with.
We're registered nurses that see the effects of the denial of care every single day of our work life, and we're sick and tired of it. The biggest obstacle to change here is money. And it's the insurance companies, it's the pharmaceutical companies, it's all of the companies that make money off of the misery of patients.
Single payer is the most conservative proposal out there. It costs less, it does more, and provides a level of quality.
This would provide health care from birth to death, cover all medically necessary services, including prescription drugs, long-term care, and hospital care. And it has this funny question.
Well, how are you going to pay for it? We're going to break the bank. Not under a nonprofit single-payer system. We'll probably save about $350 billion per year just in reduction in paperwork, administration, and bulk purchasing of drugs.
This would be tantamount to improving and extending Medicare to the entire population.
The secret actually is to marry the two strengths of the American healthcare system: public financing and private delivery.
Medicare is, after all, a government-administered single-payer system embedded within our private market-based system. It's much more efficient than the private insurance system, with overhead costs of less than 4%. And unlike private insurers, it can't select whom to cover or deny care to those who need it most.
This plan would cost no more than the current health care cost in this country.
31 cents on a dollar spent on health care goes to something other than health care, and that's a problem. This happens because people are hired specifically to prevent their employer from paying the bill. In fact, an entire industry is based on that task. They're called insurance companies. They do not deliver health care. They do not heal. They do not prevent disease. They make money not providing health care.
This, I believe, is the #1 issue, Mr. Conyers, and that's why, Chairman, I'm so happy that you're beginning this process and pushing our Ways and Means and others to do this.
Health care is a right, it is not a privilege, and that is what the message of H.R. 676 is.
Overwhelmingly, I believe the American people are ahead of the politicians on this issue for national health insurance.
Congress must act now because we can no longer wait. Patients' lives are at risk. Patients have died as a result.
And I ask Americans across the country who are asking me, what can we do? This is something you can do. Write to your member of Congress and say, get behind H.R. 676.
And I want to let you know that we have tons of medical students just like me, thousands of young soldiers across this country that are ready to fight for the most cost-effective and equitable way to provide the most quality, comprehensive, and affordable health care for everyone. We're ready to fight for single payer.